Noel Floyd's here.
Hey, Noel, how are you?
Good. How are you doing, Gary? I don't think we've ever met on the phone or anything.
I don't think we have either. Denise and I just spoke about you briefly yesterday, a couple of days ago, and she asked me to present to you folks and make sure we're all on the same page and make sure you guys have some of the tools that you need, well, almost all the tools you need that you guys walk in and send it.
Awesome. We really appreciate you doing this for us today.
Hey, no problem. I'm more than happy to help. So, the more successful I can help you guys be, and the better I can help you, and the better I educate you, the better quality of samples we're going to get coming into the laboratory, and that's what, and that really makes a really big difference to have these types of meetings. Noel, could you do me a favor and tell me a little bit about your group and what type of practices you guys tend to work with?
Well, as of right now, most of us are coming out of the telehealth, is what we've been doing. Most of us have. A few of us here have already started tackling brick and mortar, some just normal private practices, general practitioners, things like that. But and the reason being is because we were so focused on genetics. That's what we were so focused on, and I didn't even realize, I guess, until just a few weeks ago, Crestar had so much more that we could offer. And so Ed Clapp had actually gotten on with us, I believe it was Monday or Tuesday, and really went over some things that we could offer through you guys, which it really excited everybody, because the requirements are always changing with some of these like the CGX, and you're having to go to say, well, I know I told you this, but now it's this, and so there was a little bit of frustration there. So I'd gotten with Ed and said, is there, what can we do? What can we offer to where we're just not throwing our hands up in there and say, hey, we're just kind of done here. So he got with us, provided us with some great information. Denise had forwarded over that new suite of services I think you guys had created, which looks incredible. And so I think a lot of us out the gate now are going to be probably focusing on pharmacogenetics and maybe the RPP as well, because we find that very fascinating. I know I've got one rep. He may be listening in. I told him, I said, you need to look. I think he might be driving down the road. He couldn't make it to do the visual. But he's got in with a clinic right now that there's actually like 103 locations, and I think that may be what he's leading with is the RPP. And we just learned about that just a few days ago. We didn't even really know that was an option for us. We've got a group of people that are excited. We actually, with Crestar, we just brought our first doctor on just a few days ago. And so I'm excited to see this new portal stuff, because he's eager to get started as well, taking in some samples and things like that. And now we'll be able to bring him other things that you guys offer as well, other than the genetic testing. So that's kind of where we're at. We'd had some major sales and stuff like that with the telehealth portion of it, and I have been doing that since really, I guess, February. And but with all the changes and everything, I really feel like what we need to focus on is brick and mortar, because it's too much of a gray area in that telehealth area. So we're just completely focused on brick and mortar at this time.
Beautiful. That's what I like to hear, because one, we don't take telehealth samples any longer. So that's one thing I need to make sure you guys do understand, that we do not take telehealth samples, just because of that reason, of the grayness. And we as a management team made the determination not to continue to take telehealth samples going forward. So with that being said, I have a significant clinical and laboratory background. So when we started doing this pathogen testing, you guys cannot imagine how excited I was, because this entails everything from my background. So I am very versed in this, and I love to talk about it. So I'm going to make sure you guys have everything you need. Okay? That's great news.
That sounds great.
All right, good. I'll tell you what, this pathogen testing that we're talking about, the UTI, the RPP, and stuff like that, it will sell itself. The days of having to walk into an office and start saying, hey, I can create a personalized med list of medications that a patient can or cannot metabolize based on their specific genetic makeup and that mesmerizes people, but to get a doctor to actually believe in it enough to start ordering on everybody can be kind of hard. And with the hereditary cancer testing, now that all insurances require a personal history, people look at you and say, what's the point? And so to be able to offer this pathogen testing, I'm really excited about it. I just left a lunch meeting and I went and met with a geriatric ARNP, and she looked at her nurse and she goes, we are going to do this instead of sending out for urinalysis on all our home health patients and all the patients that we see every day. She goes, we're going to send them to Gary's lab and we're going to get more accurate results. So that was a good lunch that I had today. So that's why I'm in an extra good mood. So have you guys had any formal training with us in any way, shape, or form? Have you went over like a new account enrollment form like what I have up here on the screen?
We have, but what Denise sent me, we've had training on this right here. It looks shorter. This looks like maybe a new account enrollment form. I think the other one was about 6 pages. That was the cool thing that happened. Yeah. So when Denise and I came on board, we went through everything that this company had to offer, and we made changes, and we made things more streamlined, and kind of clean things up, and kind of really kind of put some things in perspective to make things easier for you guys. So can anybody see my screen?
No.
Okay.
No.
Yeah, I see it.
I can see it.
Oh.
I see it.
Guys, if you're on a phone,
some people can, some people can't.
Some of you guys, if you're on a phone,
if you're on the phone, okay. If you're on the phone and you're trying to view this on the phone, you can't see it.
No, I'm on the computer.
Okay, and can you see it on the computer?
No.
Okay.
I was seeing it, but now it's off.
Okay, there you go. Was this William?
Yeah, but I didn't hear what Marquita said.
What she was saying was
William,
she
I think she was just X out of that screen.
I can't hear nothing.
Okay, so make sure to mute your microphone on your computer.
Yeah, I've got that's me. I'm trying to do it again here. Come on.
Okay, yeah. So go ahead and just exit out as you can again.
All right, now I'm back in now. And it says, you're presenting to everyone.
Yep, that's me.
Stop presenting? Yeah.
No. Hold on. Can you see that now?
Yep.
Got you, buddy.
All right. Can everyone who's on a computer see my screen now?
Yes.
Yes.
Okay.
You got it, Marquita?
Everybody good?
I believe we are.
Okay. All right. No problem at all. So this is the new account enrollment form. Okay. Every time you sign a brick and mortar doctor, you need to fill one of these out for the practice. Okay. You need to start by putting, and I mean, I know this may seem simple, but people sometimes have a hard time doing this. So the company name is going to be the name of your group. Okay. So, what's the name of your company?
It's Conducted Living.
Conducted Living, and that's the name of your entire group.
Yes, sir.
Okay, so Conducted Living would go here, and the representative's name would go here. That way, every single practice that signed up is associated with Conducted Living. So that's how that starts. Then you fill out all this information accordingly. Primary contact person, and we need the name of the person who's going to have access to the portal. The portal is where they're going to retrieve their reports. So we need their name, their email address, and I don't know why, but their position at the office. Okay, so this is, they're going to get an email.
More than two, Gary. What if there's more
Well,
than two that's going to have access?
Then they're going to have to share a login. So they'll have to share a login. Usually I find with most facilities, there's one person kind of in charge of going into the portal, opening up results, and then uploading them into the patient's chart or printing them. But if there's more people involved, let's say you have, you have 6 doctors, you have 6 MAs, and they can share a common portal login. As for now, I think in the future we actually have a new Lymphinity system coming soon, which may allow for more users. But for right now, it's only allowing us to set up one. Then you make sure that you put the doctors, every single doctor that's going to be ordering a sample, make sure that you write their first name, last name on here, their NPI number, and their signature. And if you can get their email, that would be great, because as we need annual paperwork sometimes to be signed off and sent back in, it'd be really handy to have their email address so we could do it all electronically. After that, you can try and guesstimate their volume, and we like to try and determine their payer mix and get the hours of operation. And if they want to start setting up a UPS time, we need to know that as soon as possible and start getting to work on that. Any questions about the new account enrollment form?
What about the account preference?
Account purchases. Oh, okay. They're going to be ordering on paper requisitions for now. They're going to be using a CrestarLabs portal for now. This is for the future, and this isn't really anything we're going to be using for now. Just so you know.
All right, good. Okay.
Sorry about that.
So Gary, on paper requisitions,
any other questions?
Can they do digital? Can they choose to do digital only or paper, or does it have to be paper? And I guess the paper requisition forms, are they faxed in, or they? How do they get into your system digitally?
They're sent in with the sample.
Oh, so that's like the only. I got you. I understand that then. For some reason, okay, so they're all like hard copies.
You're thinking telemed. I got you.
I got you. Okay.
Yeah, you're thinking telemed.
Yeah.
I understand. No problem at all.
Okay, wonderful.
Okay, so then after you get that filled out, you're going to submit this to new count enrollment at CrestarLabs.com. Okay? After that, you're going to go to order supplies at CrestarLabs.com. You go to the CrestarLabs.com homepage, and there is a tab that says order supplies. And at that point, you'll go through here and you'll order all the supplies that the site needs in order to do their testing. All right? And I'll show you how that works in a few minutes. Any questions?
I think that's pretty straightforward right there.
All right. It is. So are you guys staying away from cancer right now?
No, not at all. I mean, we mention it and bring it up. There was just, over the past few months, there's been so many changes with the Medicare guidelines, and now Medicaid is adopting a lot of the Medicare guidelines, and so it's not something.
Truly, absolutely. So, absolutely, yeah, and I completely understand that. Let me pull this up really quick.
I think we're going to start out leading with the PGX, Gary. That's what we're going to.
I would lead with the PGX, and I would lead with the UTI, the RPP right now, because it's cold and flu season. And these places also deal with tons of patients that constantly have UTIs. So here's our requirement for cancer. All insurances, every single insurance, a patient has to have one personal history of cancer at least. That's all insurances across the board. Commercial, Medicare, Medicare PPO, Medicaid that the state will accept. Okay? Hold on, someone. All right, Susanna's in. Okay. So, that, and I'll go over that. So, have you guys went over? So also I have the Medicaid by state coverage guide, and I'm gonna. Noel, did Denise send you all this stuff yet?
I don't think I have that. That looks like a different list than what I had before.
Is Noel still on?
I'm sitting here talking with my phone on mute. I was saying that looks like a different. I'm sorry, that looks like a different list than what I had before. So
okay.
Yeah, I would love to have that there.
Okay. Okay. So after this call, I'm going to send everything to Noel, and then he's going to be able to distribute it all to everyone. Okay. So with this Medicaid list, it's really important to look this over because, for example, Alabama, we can do pathogen testing, but we can't do any genetic testing in regards to carrier, PGX, and CGX. So please make sure that when you're using this Medicaid by state coverage guide, that you're looking for the X's under the tests that we offer. So I'll make sure to send that to you. So with the PGX form, have you guys all seen this form before, and are you guys familiar with it?
Yes, sir.
Okay, account information up here, requesting provider, date, time collected. Since you guys are going brick and mortar, I'm gonna go over this form a little bit because it's gonna be a little bit different. Okay, patient's last name, first name, date of birth. After that, you can go right here and write please see attached. At that point, you can attach a demographic sheet, a copy of the patient's insurance card, and the office notes for the day that state medical necessity. When marking off the panels on this form, you're going to draw a single line down through all these genes, and that's going to be comprehensive. That's how you order a comprehensive, is you draw a line down through all the genes right here. This section F, where it says genetic counseling, this isn't telemed, so this doesn't matter. They don't need to do anything with section F. After that, we need a patient signature and a provider signature. Also, by attaching that office notes for the day, that also has all the diagnosis codes in there. On the back of this requisition, we need to make sure that the provider marks off other medical necessity that's needed. And every single genetic sample that comes into our laboratory has to have a Z code, a genetic encounters code, Z13.79, documented in the notes. For your Medicare and your Medicare PPOs, the patient must have one diagnosis code that's on the back of this requisition. Either an F code, a Z code, or, a Z code, or one of these I codes. If they have a Z code, they need to have an extra code. So if they're on long-term use of anticoagulants, they have to also have another reason why they're on long-term use of anticoagulants. That can't just stand alone. So usually when they're on anticoagulants, they have history of like thrombosis, atrial fibrillation, things like that. So we need to make sure that we're getting every single diagnosis code from that provider in with these samples.
I don't know about anybody else, but I'm totally very unfamiliar with this.
With diagnosis
no
codes?
clue what you're talking about. Yeah. I have no idea what you're talking about.
Okay.
Is that something that we do, or the nurse or office manager or doctor would do?
The office manager, yeah. The nurse will be able to get this information for you. So
good deal.
So hold on just for a second. Let me just make sure. Hold on, let me just check that I got this typed out for you guys. So I make sure that it's very cut and dry for you guys. Hold on here. Okay. So I do have this, yeah. Please attach copy of demographic sheet, office notes that include medical necessity. All right, so please make sure that you include those things. So we need a face sheet, which is a demographic sheet, a copy of the insurance card, and we need the office notes from that day's visit. And a medical assistant will know exactly what you're talking about. In those office notes, there needs to be medical documentation of what test is being collected and why. Patient is on multiple medications. A PGX test was collected today to assure that the medications the patient's on are the most genetically capable or medically necessary. Something to that effect. We just need some documentation for medical necessity. Also, on those office notes, it will have all the medications the patient are taking, and it will also have their diagnosis codes. So, for example, if a patient has the diagnosis of unstable angina, they're going to have a diagnosis code in their chart of I-25.760. So, as I said, you can also have the site, please write this down, have the site include a problem list. A problem list will have all their diagnosis codes that's associated with that patient. Did I clear that up for everybody? Is everybody okay with that?
Clear as mud. All right. We'll get this.
Yeah, you guys got this. I mean, yeah, so this is only for Medicare and Medicare PPOs. If you're doing any other type of insurance, all they need is 2 or more diagnosis codes of a chronic condition, such as like hypertension, diabetes, hypercholesterolemia, just some reason that that they're taking medication. And as I said, if you go over the CGX, PGX leave behind that I'm going to send you and what's required, the medical assistant's going to know exactly what they need, because that is what's needed every time they submit for any type of testing. Okay?
That's great.
And then, okay, so now I'm going to pull up the cancer form. Again, we have the account name, the requesting provider, first name, last name, date of birth for the patient. Then you can write see attached. Again, you're going to attach all the same information. So we were talking about cancer and how it requires a personal history. This is where you would document any personal history of cancer, what type of cancer it was, the age of the personal history, and the corresponding ICD-10 code. And then any family history, you would put in the corresponding boxes here, the corresponding boxes here, the age and when they were diagnosed, and the appropriate ICD-10 code. And the medical assistant will know exactly what they need to do in regards to this. Nothing is needed here with genetic counseling because we're doing brick and mortar, and the patient needs to sign and the doctor needs to sign. And in order to order the comprehensive test, this is just like the pharmacogenetic, you're just going to draw a line straight down through all the genes that we test for.
What's the age requirement, Gary? 80 or 82?
I think there's a cutoff. There is a cutoff. Hold on. Let me.
Yeah, when we worked with the telehealth, she cut it off to 75, but I think you all were able to go up to 80 or 82.
I don't think it's 82. I think it's 75. Because did that telehealth company work through us?
They did, but see,
Well,
we were doing 8 years old for you guys at first, and then she set her own guidelines and said she was going to cut it off at 75 because they had called some 78-year-olds and they didn't remember or recall having the test, And so she's like, you got to draw a line somewhere. So, and it wasn't that they didn't recall having the test. I think the deal was that they were dragging their feet, and these people had had the test literally 3 and 4 months before. Of course, they're not going to recall. I don't know, but anyway, we were a little frustrated with the telehealth side of things because they were really dragging their feet on calling the patient and things like that.
Okay, so here we go. CGX 18 through 75.
75. So what's the PGX?
Okay, hold on. CGX. There's no age limit on PGX because PGX can benefit you because it has to do with metabolic metabolism medication. CGX 18 through 75 and 75 and older if they've had a personal history.
So with you guys, there is no age limit then.
As long as they've had a personal history, and now we require everyone to have a personal history. So, again, on the back, I didn't hit that. On the back of this requisition, there is some medical necessity questions. Please make sure that the provider marks that off. Again, as I told you, for every genetic test that comes into our laboratory, we need one of these genetic encounter codes. We need a genetic encounter code, which is one of these Z codes right here. And then these codes, these are all history. These are all, these are codes that come with it, but these are all codes that are it's just a quick reference guide in regards to diagnosis codes. But we have to make sure to have that encounter code, that Z encounter code in the notes or somewhere. And again, I'll pull this up again. Non-qualifying personal history: melanoma, lung, liver, kidney, and bladder. So they can't have a personal history of those. And as I said, I'm going to send you all these documents. When you guys are doing PGX and CGX testing with your facilities, make sure that you print this out and you leave them with this code, with this sheet. Because this really lays everything out. And if you follow the instructions on here, your samples that come into the laboratory are going to get ran and they're not going to get rejected. Or they're not going to get put on hold, or you're not going to be waiting to try and get things fixed. So everybody okay with that so far?
Sounds good. I like this sheet right here.
Okay. Yes, I typed that up because it just makes life so much easier for everybody to have it just right in front of you. I'm going to go over the Maui swab that we use. I know you guys have used them before, but I just want to make sure that we're very clear on how to use these. That's just reminding me. I gotta send that. Okay, sorry about that. Okay, so with these Maui swabs, you can order these instruction cards to come also that you can leave at the office. You take the swab out of the vial, swab the inside of the sheet 15 to 20 seconds each side aggressively. Open up the vial and place the swab inside the vial. Move it up and down within the liquid, and as you're bringing it out, twist it because there's bristles inside that cup that actually will extract the DNA off the material. Off the swab. Inside each one of the bags and kits that come, it also comes with 3 barcode labels and 1 name and date of birth label. Please make sure to put the name and date of birth label on the cup, on the collection vial, and also put the barcode on the collection vial. But the other barcode, make sure you put the other barcode on the requisition. And all of that information is also on the PGX link behind I'm going to send you guys. Okay, everybody comfortable with how to use the swab?
Yes, sir.
We're on the application. Does the barcode go, Barry? What you put on
on the requisition, on the requisition, that's okay. On the requisition, it goes right up here, anywhere, just right up here in the top right corner.
Perfect.
And that just marries that sample to that requisition. So, are you guys doing any toxicology testing or anything like that?
Personally, I've got a really good contact where I'm trying to close a deal right now, about 600 pre-employment drug screens a month, or what would you call it, randoms. Pretty big organization. They're in 6-7 states.
Okay, so that would all be workman's comp?
Self-pay.
That'd be self-pay?
Yeah.
Like you would have a client bill agreement with the facility?
Yes, sir.
Between Crestar and this facility?
That's right.
And, okay.
So they have MPI number if that's even necessary, and they have nurses on staff. It's actually my wife's place of employment. The lab that they're using is having some trouble because of the wildfires. It's really put them behind in California and things like that. So I'm trying to. The thing is they're under contract with them, but I'm thinking like, well, surely it's a breach of contract since they can't process your orders right now, or and it's basically a self-pay thing. I've talked to Dakota White about it, and Dakota said basically we set them up as a self-pay. And they would just contract do self-pay and bill it out like that. So that's how it would be. It would be strictly all new hires and random drug tests that they do.
And randoms.
Yeah.
Okay. All right. Yeah. So so we do have a toxicology requisition form here, and they can your facilities would definitely understand this form completely. I used to work in a workman's comp clinic a long time ago. These don't vary by any other means. Everybody knows how to fill out one of these requisitions. If you take them to a facility, they're going to know how to fill this out. So they would just need all this information, a copy of the patient's driver's license, so they can get all this demographic information, and then they would fill out if they did the POC testing there, and then they would order any type of confirmation testing that they want done, and that would be based on whatever contracts they have and whatever panels these different employers want to do. So they would just fill this out accordingly based on how the different employers and companies that use them want to do the test. All right. So I'll make sure to send you a copy of this also. But again, it's incredibly simple: patient signature, provider signature, things like that. Do you guys currently have any samples from another laboratory that you're looking to send us?
Yes, we do. I've got one rep that we were. You're talking about that right there, laboratory change. We've probably got it's not many, 15, 20, something like that.
Okay. So for every provider that has ordered a sample, we need a laboratory change form, one per provider, not one per sample, one per provider.
Okay.
And what type of samples are you sending in?
PGX and CGX.
Okay. I'm going to tell you this from the laboratory standpoint. When you're sending it in from another laboratory, you need to make sure to go through each and every one of those samples and go through the PGX and CGX requisition guide.
Okay.
Yes, because other labs have different requirements. Okay, and if they don't fill the requirements for which we have, there's no point in sending them to us. Because then it's just going to cause you to have a problem list, and samples on hold. So please make sure that you follow this guide to the letter and make sure that everything is labeled accordingly and that everything has the Z encounter code under the diagnoses, and that you have all the information here that is required by us. I just know that the laboratory's had a lot of problems with this in the past, and it's really causing a lot of work.
Gotcha.
So please make sure that you share this with them, and that everything follows this information that we're sending you.
Hey, Gary,
All right.
just what you're talking about there. What we need to get that filled out for now?
Oh my gosh.
Okay, so if you have samples from another laboratory that you'd like to send to us, you have to fill out this
All right.
yeah, this laboratory notification of laboratory change. And every ordering provider that has ordered needs to fill this out. You're going to send this along with the samples after you went through each one and pre-check them and make sure that they still are required.
Gotcha.
Okay, because if you send us, let's say you send us 50 cancer tests and all they have is family history, and we're not going to run them, and unfortunately you can't have them back. So please make sure that you go through all those samples and screen them accordingly before sending them in. Any questions about that? Okay, then we will move on. So you guys are able to track. You guys are going to get one login. No, you're going to get a login, and you're going to be able to see everybody's samples.
So will that login change? I currently have they were talking about a new portal. So I have a login for a portal right now. Is that changing?
You do. Okay, that's going to change probably next month.
Okay.
And they'll send you updated information. So you already have portal access?
I do. So the physician that we just brought on will be accessing his stuff through the current portal. Is that correct?
Correct.
Okay.
So so the physician that you brought on, you mean the office that you brought on?
Yes, sir.
Okay. So he'll have his own portal access for samples just for him.
Okay.
You will have portal access that will show you everything that you and Noel will share, and you can see everything. Stuff that comes in. And it's important that you look at this every day to make sure that things aren't under problem logs. And so these are received, there's test in progress, but you need to make sure that anything that has a problem next to it, hover over the notes, it will tell you what it needs, and you need to call the laboratory and get that fixed as soon as possible.
Okay. So will
because
he
if
get
not, it's never going to get ran.
Or something to set his portal up, or what?
The doctor, as
Yes,
soon
sir.
as you send in the new account enrollment form, that will have. Hold on, let me just pull it up. The new account enrollment form. See, it has right here
Yep.
who is going to have a portal access. So this is the person that's going to get the portal access right here.
Right.
And that's how the account will be able to go ahead and log into their portal.
See, I think that old form didn't have the
And-
email right there.
It may not have. I can't remember. It's been a while since I tore that thing apart.
So we sent it in last week. Might have been the week before. But Denise had called me and asked me about him.
And
And she said, well, I need to get the portal set up, but I haven't heard anything else about that.
okay. So
Last Friday, though.
It was last Friday, that's right.
so send an email to new account enrollment
Okay.
at this address right up here that says, please make sure to send the account's login information to Jan Smith and give them
Okay.
their email address.
Gotcha.
Okay?
Gotcha.
Okay. So all right. I've already went over pharmacogenetics and CGX with us. Are you guys doing anything with carrier testing, non-invasive prenatal testing? You guys dealing with OBGYNs and like fertility and all that stuff?
Not yet, and
We will be.
We will be though. I'm really interested in the RPP.
Okay. If you guys want to talk about respiratory testing, you guys are right up my alley now. Okay, so I'm going to go over pathogen detection, okay? So for pathogen detection, we offer the following. We offer respiratory, women's urogenital, urinary tract infection, wounds, and fungal. A pathogen is a microorganism that can cause disease. Is pretty much what it is. And, we see this all the time with people that catch colds, people that get urinary tract infections, people that get wound infections. These are all caused by pathogens. And since the dawn of time, basically, in the laboratory world, the way we've tested for pathogens is if we've done it by a culture and sensitivity method, which is a very subjective way of doing it. We take a look at a urine under a microscope. We see certain criteria in there to suspect that there's an infection. We then take that sample, we put it on a plate and streak it, and then we put it in an incubator and let it cook. For what we see that grows on there, which is subjective again, we then try and identify it, and then we try and give a recommendation on how to treat it. That can take 3 to 5 days. With pathogen detection, what we're able to do is we're actually able to take a sample, whether it be respiratory or urinary or vaginal, and we're able to put that on an analyzer, which is called a PCR analyzer. And we're actually able to detect the pathogens in that sample with this analyzer, and we're able to extract their genetic material, amplify it, and provide the doctor with the information of all the pathogens that are in that sample, their qualitative amounts, and what antibiotics won't work on that to treat this. So that is what pathogen detection is. Urinary tract infections are one of the most common infections ever. And it definitely causes a lot of emergency room visits. It causes a lot of hospital visits. And the reason I say hospital visits is sometimes it's not treated properly in the beginning, and it can exacerbate into a much worse infection going into the kidney and causing a lot of other issues. And it can actually lead to hospitalization. So the benefits of doing the UTI testing is it's actually 25% or more accurate compared to traditional culture methods. We're able to detect multiple different microbes, and we can actually result this out 24 hours from the time the histocomes out, rather than 3 to 5 days as the other methods that have been used in the past with the culture method. All it takes is a urine sample, a clean catch urine sample, and then it gets transferred into this yellow top culture and sensitivity tube, and it gets sent to the laboratory overnight. Once the laboratory gets it, they process it. You'll have the results within 24 hours in our portal. So that is UTI detection. And is that pretty straightforward? I'm going to send you guys all these slides also of collection of submission and all this stuff. Yeah, I'm going to send you a lot of stuff. Is actually what I'm going to do. And it's going to help you guys really hone in on selling this. One thing I want to kind of help you guys out with when it comes to this is the other methods are very subjective. It's very someone making a decision based off something that they see, where this testing is quicker, a lot more accurate, it's a lot more sensitive, there's less chance of cross-contamination, and much quicker turnaround time with this. And as I said, it's just much more accurate. It's just wonderful. Again, it's just a sterile urine cup, and then you send it to the lab. You're going to have different UPS labels. You're going to have next day air labels, which that goes to our Kentucky sister lab, and that is only for this pathogen testing. All the other UPS labels that you have will be 2-day air, and that will go to our Tennessee location. Okay. We also do urogenital pathogen testing, which is basically we're replacing the vaginal culture. And what we're able to do is we're able to differentiate between vaginitis or bacterial vaginosis or yeast infection, which, you know, can really, really, really be beneficial to an OBGYN practice, because a lot of times they were having to do a lot of different testing, and it was taking a lot of different time, and it just, you know, and it just caused a lot of work. Also, in this vaginal urogenital detection, we can also test for some STDs, such as chlamydia, gonorrhea, trichomonas, and with a separate collection device, if they feel that there is an ulcer or a lesion that may be herpes, they're able to swab that with a separate collection device and send that in also. And again, they're getting these results in 24 hours. These tests take 3 to 5 days each to come back. Faster detection time, quick differentiation, so you can determine appropriate treatment, and we are ability to test for some sexually transmitted diseases. As I said, I'm going to send this to you guys. Make sure that you guys really go over this really, really well and read through these, you know, what's actually necessary. Make sure that if you're submitting two different sites, like let's say you're doing a vaginal collection and there's also an ulcer or a lesion that the doctor wants to test, that you make sure that they're writing the name of the source on the collection tube itself. This is the e-swab that we use for the testing, and these can all be ordered using the supplies portal. And this is the collection device and the process on how to collect it. Respiratory pathogen detection. This is a great one. It's called flu time. And you want to make sure that the doctors aren't just handing everybody Z-Pak, because respiratory infections can be really incredibly severe. And the importance of the RPP testing is that we're able to tell whether it's bacterial or viral. But even more, we're able to actually tell the provider what the actual pathogen is. So they may just hand the patient a Z-Pak and then get this report back and say, wow, actually you have a very strong bacteria in there. This Z-Pak's not even going to touch it. We need to put you on something. We need to put you on something heavier to keep you from not developing like pneumonia or something like that. So this really helps also, and I'm going to show you some sample reports, which also kind of reiterate what I'm talking about. Again, this is 24 hours after it hits the laboratory. They're able to get this result. And here's something I found really interesting that I put in here. There's an estimated 55% of antibiotics for prescriptions that aren't even necessary, that are going out to these patients.
That don't surprise me a bit.
Mm-hmm. And now people wonder, you know, why we have antibiotic-resistant bacteria. It's because of things like this. It's because the doctor goes, I'm not going to do a culture on it. It's going to take 3 to 5 days. And by the time I get that back, you're going to be fine. Well, so, you know, here's a Z-Pak, you know. So we're trying to, I always sell our services as we do everything. We provide precision medicine based on genetics, whether it be the genetics of the patients themselves or the genetics of the pathogen. We deal with precision medicine by using molecular genetic techniques. This is just a nasopharyngeal swab. It's called an e-swab. It's e-swab mini. It's just a nasopharyngeal swab. You just stick it up the sinus until it stops, and it makes the patient's eyes water, and then you rotate it gently to obtain a sample, move it, remove it, put it back inside this kit. Make sure to label it accordingly with the name, date, time, collection, everything. You can also test for strep, and the different types of streps there. You would just need a separate swab. and you would just get a sample, a throat sample. And again, just make sure that you label your collection devices with your sources. And again, make sure that you use your next day or shipping labels. We can also do nail fungus pathogen testing. Traditionally, when I worked in a laboratory, this test would take 4 to 6 weeks to come back. So if you guys know any podiatrists, you can start marketing these to podiatrists. And we're able to get them results in 24 hours with just a nail clip. Faster detection time, and we have the ability to tell them the exact pathogen present without having to send it out for separate ID testing. After you waited 4 weeks or longer, something finally started to slightly grow, then you send it out for ID testing. You know, you're out like another week. So just a nail clipping, you submit it in the collection device tube, make sure that you label it all accordingly, and you send it out with the pathogen detection, and you send out the proper requisition. And as I said, I'll send you all that stuff. Another test we offer is wound pathogen detection. So if you start talking with doctors that work with geriatric patients or nursing homes or infectious disease doctors, this is some really great testing, because there's a lot of people that come back and forth with these wounds that won't heal. And, you know, the doctors just tried broad spectrum creams and antibiotics and things like that, but they really don't know what the actual bacteria is that they're treating. So we're actually able to select appropriate antibiotics when current therapy fails. We're able to determine appropriate therapy. We can identify antibiotic resistance. It gives a wealth of knowledge to the doctor to really take the trial and error out of prescribing when treating these types of pathogens. Similar to how when we're doing pharmacogenetics, we're trying to take out the word try. Okay? We're trying to help them determine the best course of therapy for a patient. Again, by using specific genetics, as we're doing here with pathogen testing, we can give the doctors a treatment plan that's going to help them based on the genetics of the actual pathogen itself. So that's just, again, there's just an e-swab. Just swab the area and make sure to note the source and send it in to us. I'm going to actually show you I want to show you a wound panel. This is what the results would look like if you swabbed a wound. You're going to be able to tell exactly what this is. Now, you can't tell me any doctor that could just look at a wound and tell you what these pathogens are. You know, no way. This is going to give them the tools to know exactly what this is. It's going to tell them the antibiotic-resistant markers. I'm sorry?
I was going to say, is this also a 24-hour turnaround?
Yes, all pathogen testing is a 24-hour turnaround time.
Perfect.
So then we're going to even give them sensitivities. And we're going to give them resistant markers like this would this wound would not respond to methicillin. So they would not give them any type of methicillin-based antibiotics for this, or ESBL, which I don't know what that stands for. I'm sorry, but I do know that this could be a possible MRSA in a sense that it is methicillin resistant. So it's really important that we're able to tell them exactly what it is, and the respiratory panel is another good example here. And you know what I do is I print out these sample reports and I take this with the suite of services and I walk into the doctor's office with it.
Great idea.
And I start out by saying, look what I can do for your UTIs and RPPs. And hi, I'm here. Let me show you what I can do about wounds. Let me talk to you about pharmacogenetics. Let me tell you about our suite of services. but I always kind of walk in, especially during this time of year, and depending on the facility, I've been printing out these sample reports and walking in with the suite of services. The requisition for pathogen testing, very simple, very straightforward. Again, see attached demo, insurance info, and office notes. That's going to have your medical necessity in there. And then you mark off the appropriate panel that you want to do. So with urine, if you want to do the whole urine panel with the sensitivities, you've marked off the UTI ID panel complete. And that's going to test for all of these different bacteria. With your respiratory, as I said, you're able to tell if it's viral or bacterial. So you would mark off both of these, and that's going to give you the full, that's going to give you the full respiratory panel. If you also want to do the strep test, you mark this off right here, and you get a separate throat swab. We have chose as an organization not to do gastrointestinal testing because, for the God honest truth is we don't like to play with crap. And that's what all this testing is fecal swab. The reimbursements aren't that great on it. And it's just something that we chose not to do.
Man, they're doing that stuff on TV now. We don't need to mess with that stuff. That's seen on TV.
Yeah, exactly. So with the wound, we can do all of these also with the wound. Also, if they want to check for fungal in the wound, they can just mark off fungus, and this will test for fungal and bacterial for the wound ID. And if you submit a nail sample, you can just mark this off. So it's a very easy to use requisition. You see here it says use an e-swab. All the tests under here use a urine and a CNS tube. Everything under here use an e-swab. Everything under here use an e-swab. So it's very laid out, very straight, clear, easy to definitely know what to do. This marketing stuff we just got. Denise and I worked really hard on putting together all the verbiage for this. You guys can take this to Kinko's or OfficeMax and get these printed. I'm going to send you all these also. But this is our suite of services. This is everything we offer. Right now, we don't offer the Parkinson, Alzheimer's, dementia test, which is we're looking at 35 genes to see if a patient's more predisposed to developing Parkinson's, Alzheimer's, or dementia than the general population. That test is probably coming out in January or February, but as of right now, we don't have it. We spoke about cancer. We spoke about pharmacogenetics. We talked about wounds. Talked about fungal pathogen detection. Did you guys say you guys were going to be doing any carrier testing at the time?
I believe eventually we will. I know right now no one's hitting any gynecologists or women's health centers or anything like that.
I'll tell you what.
Eventually we will.
I'll tell you what. When you guys start hitting those, give me a call and let's make that a separate conversation.
Sure will. Absolutely.
Because let's have it. Because listen, I'm not a one and done guy. You guys can call me for anything. I'm at your guys' disposal. I'm here to help you in any way, shape, or form. And as new testing comes on and I learn new things, you'll see me send out giant emails to groups sometimes of things. Hey, we have this down. This is how this works. If you have read through this PowerPoint that I put together. If you have any questions, call me. Or if you just, or if you're on an account and a doctor's asking questions and you just have no idea, just call me.
What's your cell phone number, Gary?
My cell phone number is 207-319-2298.
Great.
And you guys can call me anytime. I don't mind. That's what I'm here for.
That's fantastic. That's very helpful, Gary. Thank you so much.
Yeah, no problem.
We have some agents that live around a lot of pain clinics. Is there anything we can approach pain clinics on?
you're going to approach your pain clinics on drug testing, and you're going to approach them on pharmacogenetics.
Got it.
Because you want to make sure that they're on the most. You want to make sure that they're on the most successful pain medication for them. Because they could be a hypermetabolizer, a poor metabolizer, or a slow metabolizer. And these patients come to you and say, listen, I take 10 oxycodone a day and it doesn't do anything. And the doctor says, you're full of crap. But they run a pharmacogenetic test on them. And the next thing you know, the patient's a poor metabolizer of oxycodone. And you should put them on some other opiate. Bam, there you go. They can't even metabolize it. They can eat them like M&Ms. It's not going to do anything.
Wow.
You know? Also with pharmacogenetics. Yeah, I mean, I can take a medication, you can take a medication, and it's going to do two different things based on our genetics. You know, pharmaceutical companies try and treat patients as a whole, and you can't. And that's what we're taking out of there, and that's why we're offering precision patient-based medicine. And again, with pharmacogenetics, we're talking about pain medication. Another one is the psychiatric medication. You know, there's a lot of trial and error with psychiatric meds. We want to make sure that those patients are on the best medication for them. Because with psychiatric meds, you put a patient on a medication, you say, come back in 6 weeks. Patient comes back in 6 weeks after taking an SSRI and said, it's not working. This is 6 weeks this patient's still been depressed and not feeling well. So we're going to up the medication, or we're going to try something different. Come see me again in 6 weeks. All right? They're going to come back and go, oh man, this one made me feel like shit, and I'm crying all the time now. Well, we're going to try something different. Same thing with your cholesterol lowering medication. So when you're marketing pharmacogenetics, really push your hot buttons of psychiatric meds and cholesterol medication and cardiac medication. Those are three things that you don't want to play trial and error with. Your cholesterol lowering medications, you put a patient on a statin and you say, I'll see you in 3 months. Come back in 3 months. They come back in 3 months, you draw their blood, and they're like, nothing happened. Right. Okay, so I'm going to switch you from Crestor to Lipitor. I'll see you in 3 months. All right, so so you're already out 6 months. This patient is at a higher risk of having a cardiac event. You know? Also with diabetic medication. I had a doctor look at me like this testing is voodoo. He tested a patient that was diabetic. His hemoglobin A1C kept going up, and he had him just on metformin, and which is just an oral medication to lower your sugar. And the patient kept coming back. His sugars weren't going down. The doctor kept telling him he's not doing what he's supposed to. Right. Well, he ran this test on him. Oh, so he ended up putting him on insulin on top of it. Put him on insulin on top of it. This test comes back. The patient can't even metabolize metformin. The patient should never have been on metformin to begin with. The patient was doing what he was supposed to, but the doctor didn't do his due diligence. Wow. I had another doctor who thought this testing was hooey, and he had a patient on a statin to lower cholesterol, and he couldn't get his cholesterol lowered, so he kept upping his dose. Well, come to find out, this patient all of a sudden developed pancreatitis. So he ran this test on him. Come to find out, he can't even metabolize this medication, and due to his inability to do so, it caused statin-induced pancreatitis in his gentleman. And all he simply had to do was switch him from Crestar to Lipitor. That's all that needed to be done. Wow. So, yeah, I mean, it just happens. It truly does. But I'm going to
do you have any sample reports? Do you have any sample reports for the PGX series?
I have sample reports for everything. I'm going to send you sample reports for PGX. Have you guys seen PGX reports and stuff like that before? Are you guys familiar with PGX?
They've all got access to them on our training website.
Okay, just go and look at it.
I know the ones with the lab we were working with, the reports that came across were very, very hard to read. They're supposed to be like red, green, and yellow as far as caution on what you're supposed to take, but they got reports came out in black and white.
Okay, so is this the type of report that you got? What was it, Coriel or was it translation?
I think we've got both on there. We've got the one that's like
Okay,
a 2 or 4
so we use
pager.
Coriel.
Yeah.
Okay, so we use Coriel for ours.
We've got your. I
And
mean, it was
ours
sent to
is
me by
very-
Crestar, so this has got to be. Yeah, it's gene dose.
Okay.
Yeah. This is what we've
Gene
got.
dose. Okay. So you guys do have this. What's really cool with this reporting is you can tell a provider, which it depends on the provider. If I have a provider that's really into their patients, like a PA or an NP that does a lot of med dosing and stuff like that, I say, what's really cool about our thing is check this out. You can go right here to Gene Dose Live, and you can put in the sample ID for this patient. And now you can even do a more medication assessment plan for this patient. And you can look at their current regimen, and you can change this so they're on here, and then you want to maybe put them on something else. You want to, you know, they're not really doing well with this medication. You can add another type of medication. And what it will do is it's going to, give me a second, it's loading kind of slow for me to apologize. It's going to give you different types of medications that you could, and the risk chart. So if you put them on this medication, their risk could go down. And it also tells you the general pricing of the medication. So if you add medications to the patient's current regimen, so see, now you can see the most common side effects between these medications that you put this patient on. And you can see that there's no drug-to-drug interaction possibilities with this medication. So you know that if you put them on Crestar, this would be a very good alternative for them. So you can go to Gene Dose Live, and you can actually create a more of a complete medication plan for this patient based on their genetics, their demographics, their lifestyle, and you know, their current indications, things like that. So that's something that's pretty neat about the Coriel reporting.
Now you just showed me something there I'd never seen before. So that the office will have access to do that right there. What you were just talking about. That's amazing.
So if they actually open this patient's report in the portal. And they can actually go to that hyperlink under Gene Dose Live. There we go. Under Gene Dose Live, right here, this is a hyperlink that they can hit, and they just put in the sample ID. But if they choose not to do that, it's still going to go over the current medications the patient's on and the different types of genetic factors and issues. And it's going to tell you why the medication is bad for them or good for them or needs to be changed. And then down the road, if they want to put them on a different antidepressant, they would put them on something from this chart rather than this chart. So it goes with the green is good, yellow, caution, red is bad.
Did you do something to the screen?
I'm sorry?
Did you do something to the screen? All I'm seeing is like who is on the webinar right now.
I'm logging back in.
Okay. Hold on. When I close my windows, That was my fault. Hold on.
No, let me go in here and mute myself. Somehow.
That was my bad.
Come on.
That was my bad.
There we go. Sorry about that, guys.
No problem. Okay.
I got I had so many windows up. I was getting click happy. So This is what I want to do. Close all. Go back. I just got talking so much that I got it because it's too many. Okay. So you're able to, so on the third page of the report, you're able to hit this hyperlink and go to Gene Goes Live. And that's where you put in the information, and you can do, you can change all the things needed for that patient, live. After that, it'll tell you the medications the patient's currently on. It'll tell you their risk. The most important page is this one right here. It'll tell you about the current medications that the patient's on. It'll give you genetic warnings, and tell you, Plavix. Also when I'm marketing this test to a lot of doctors, I say, we also test for blood thinners, Plavix, Coumadin, Xarelto, Eliquis, things like that. We want to make sure the patient's on the most effective blood thinner. You'll see a lot of times Plavix come back that the patient's an intermediate metabolizer, and this isn't the most efficient blood thinner for them to be on. Or antiplatelet, antiplatelet. But it also tells you about drug-to-drug interaction. So the platelet aggregation may be impaired because of and it'll tell the doctor all this information. So just wonderful information to know. So then again, we go into our standard classes of green, yellow, and red that you guys have seen in the past. Different medications that the doctor put them on in the future. And then anything that falls in yellow and red, it's going to tell them why. It's going to give them a clinical guidance as to why they don't want to put this patient on Strattera. Now, the doctor could say, you know what? Okay, so I read this clinical recommendation, but I think the good outweighs the bad. So, that's what this does right here, is it just gives clinical guidance. So I know we went over a lot of information, and I could sit there and talk about this, guys, for hours upon hours. But I think I've given you guys the tools to get you started. Do you guys have any questions for me? I can just minimize my screen here and pull up things as you guys have questions. What do you guys got?
I've got one.
You definitely don't want for us to digest. Go ahead, Noel.
I'm sorry? Go ahead.
Go ahead, William.
I'm going to say that you've definitely given us a whole lot to digest, and I just want us to know that all this other stuff is great, beautiful, and colorful, but you don't have to know all this stuff. All you got to do is know about your RPPs and your PGXs to get in the door. All this other stuff fall if we continue to do business with them.
It does. And and if you walk in with this suite of services and you read through it's not like we're selling durable medical equipment to people who don't have back pain. This is actually very awesome testing, and this is very patient focused, and this is really helpful testing that can really help patients. So you don't have to be fully versed in pathogens. You don't have to be fully versed in medications as SSRIs and TCAs and blood thinners and stuff like that. I worked in healthcare for 20 years. That's the only reason I know all this stuff. But you can walk in and you can you could explain to them the benefits of this testing by just reading through. It's like reading through the suite of services and just becoming comfortable with it, and just kind of reading through everything I send you guys and familiarizing yourself with it. And if you get stuck on something and you don't know how to answer a question, you can call me. I don't mind. If I'm available, I'll take your call. If not, I will call you back as soon as possible. I'm really good at getting back to people. I've actually missed 4 phone calls while I was talking to you guys, so I have a list going. I'm going to call right back as here in a bit. But don't be overwhelmed about all the information that I gave you. I'm going to send it to you. I'm going to send you all this information. It's going to really benefit you to go through it. It's going to make you more successful, and it's going to make you more money. And if it was really super easy, everybody would be doing it. So this is almost kind of like you need to make sure to educate yourself so you can get out there and really sit down and talk to your doctors and show them the benefits of this testing.
So Gary,
any other questions?
Yeah, I have to say, fantastic. I know when we first started with Crestar, I really felt the marketing material was lacking. and we had actually printed up professional brochures and things like that with just the genetic stuff on it. And we were looking. I think Jeff Alibert and I were looking at putting together like a one-pager like this, and then Denise had sent this over, and I was like, "Oh, this is fantastic." So I really appreciate that.
Denise and I working very, very hard on it. We worked incredibly hard on this, and we're very, very proud of it. And then a girl that we were working with marketing, actually, thank you. A girl that we were working with, so the girl that we were working with on marketing, she took all this information that I typed up and gave her, and she put it into this beautiful format. And as I said, you guys can go to Kinko's or wherever and get these printed front and back. And as I said, what I've been doing is I've been just going in with I've been printing a sample PGX report and a couple of pathogen reports and this one-pager, and I've been walking into offices with this. And just being able to offer more than PGX and CGX already just gives you a better suite of tools than almost any other lab is offering.
So let's say we've got an office on the hook. They're probably ready, but they might have some questions that we can't answer. Is there an opportunity to possibly get you or Denise or someone else from the lab on with them to get their questions answered, just to let them know that they would have a relationship with the lab as well?
Sure.
Okay.
Absolutely. We always want to make sure that these facilities understand that we are a real laboratory.
Okay.
We have customer service. We have geneticists. We have scientists. We have clinical laboratory professionals. We want, you could call us anytime. If you're at an office and they're just like, what about this and that and this and that, just call me. Our testing is covered by Medicare PPOs, commercial insurances, commercial PPOs, no HMOs, and we accept Medicaid in the state in which the form I'm going to send you guys. That's the first thing they usually ask is who pays for it. With your commercial PPOs, it could fall subject to out-of-network deductible, but a lot of the PPOs have out-of-network coverage in some sense. With the pathogen detection, that's diagnostic testing. So you're more likely to get that covered. So it's just, with the pharmacogenetic and hereditary cancer, we're going to run a VOB on it first and make sure that it's going to get covered. But with the other testing, it's just diagnostic testing.
That's great.
So, any other questions?
I know two people that will call me as soon as this is over. Happens every time.
All right. Happens every time. I know.
Oh, she just said, no, I won't. But
I have one quick question. Can you hear me? What's that? Okay. Is that you, Jan? I'm sorry. Any other questions?
Somebody just said they had one.
Hey, one quick question. Do the providers sign a term contract with your lab? No. Okay. That new account enrollment form is not a contract. The new account enrollment form gives us the ability to set the site up with a portal and provide the site with supplies. At no point is any of this a contract, or at any point will this cost them anything. Excellent. Thank you. You're very welcome. Any other questions? All right, then. Well, you guys all have my cell phone number. You guys, or if you want to follow your questions through Noel and have him call me, we get on a three-way. That way, I like to try and make sure that everybody's on the same page. So, that's something like, if you have a question, you can go through Noel, maybe come to me, and when Noel gets the answer, he can shoot out an email to y'all and make sure everybody's on the same page so we're not all doing different things and all have different interpretations of things.
We really appreciate your time. I mean,
Yeah, very much so.
Every little bit we can get just adds to our plethora of information that we've gathered, and we really appreciate it. Like I said, whoever you guys are working with for this marketing stuff, absolutely incredible. It looks fantastic. And I know some people don't think that goes a long way, but I think, just the professional look, I think it looks incredible. And a lot of people sometimes are sold on appearance alone.
They're sold on appearance alone. I agree 100%. Yes. The girl that did all this editing and putting all the pictures and color in did such a nice job. So thank you. I will make sure that she knows that.
Guys, I'll get that uploaded to the website.
Okay. So, all right. Well, you guys have yourself an awesome rest of your day. And again, just reach out to me with anything, or if your team is in a quick pickle, if you're in an office, just call me. All right.
Absolutely. Thank you so much, Gary.
Thank you so much. All right, guys. Well, you guys have a great evening. I'll talk to y'all later.
You too. Thank you.
All right. Bye-bye.